Rory, thank you so much for coming over here. It's actually been about a month since I've left you in the cardiology floor, so just it's good to see you and thanks for coming to visit. I wanted to talk to you a bit about the cardiology inpatient service model. I'm actually on the cardiology service right now and I'm having a great time. And I really am impressed that there's just much more consistency. The nurses and nurse practitioners always know where the attending is. There's continuity through the weekends because the same people I'm rounding on during the week are the ones that I round on the weekend. So I can see that the model really improves efficiency and reliability. But you and I were, so you were my chief resident, we were in the same training generation. There is nothing that is more important in MGH cardiology than close relationships between cardiologists and patients. So what can we do to maintain those relationships?
Well, that's a great question, Jason. I would say the inpatient care model that we have, that was about 2 years ago we went live with, one of the main goals was really to have attending physician visibility and availability on the floors for patients. And I think that that's something that does lead to efficient care, and like you said, the whole care team knowing who's responsible, whether that be the responding clinicians who are nurse practitioners or house staff depending on the floor, as well as the staff nurses, and really leads to a sense of camaraderie there. But I think it's a really important question about in terms of preserving the really the MGH ideal of the patient and their physician's relationship.
Yeah.
And I think when a patient's in the hospital, that's their most vulnerable time. That's
Yeah.
when they need the physician they know the most. And so I'd say that I really want to emphasize that with this care model, it's not only an expectation, but it's really an encouragement that a patient's primary cardiologist sees them during the hospitalization.
During the visit, yeah.
And fortunately, the MGPO does have the continuity visit program,
Right.
which can formalize this such that when you see a patient, you can document for that and also bill for that service. But even more than that, we just know that the patients really appreciate that. And I think that not only seeing the person, but knowing that they're engaged in the care.
Yeah.
And also I have to emphasize too that the communication of the primary cardiologist, the person who sees them longitudinally, with the physician who's the the inpatient attending of record, is a key piece to this too. And I think to take it even a step further, I know in my own personal experience,
Yeah.
I will tell my patients that when they're in the hospital, I will be seeing them, but we also have this dedicated care team who's seeing them as well. And people do seem to respond to that. I think setting the expectation and knowing what to expect
Yeah.
really does help. And having that extra pair of eyes too can be helpful. And really, I think one of the other key things is that we're working as a team.
Yeah.
So if you're helping to see one of my patients, we're communicating, I'm seeing them too, but then I'm also able to see a full outpatient day
Right.
and focus energy on them or other academic pursuits. So I think that the teamwork is really important, and also just letting the patient know that their primary doctor is engaged both physically and also even when they're not there.
Yeah, no, that sounds wonderful. It just almost seems like we're trying to have the new efficiency and the new reliability, but also still maintain these traditions that are so important both to us and to our patients.
I agree. I think, as we both know, in terms of medicine's getting more and more complex,
Right.
and whether it be at the computer or other things like that, there's no substitute for sitting at the edge of the bed, talking to the patient. That's the people we learn from in the
Yeah,
cardiology
right.
division here, and trying to take that into the next generation. And I think, this model is really a hybrid that allows for that to be preserved, but also allow other efficiencies just to help the patients move through their inpatient stays.
Yeah. Thank you so much for coming to visit.
My pleasure. Great to
Great.
see
Yeah.
you.